You're with BBC Radio Kent. Thank you for your company and for your beautiful calls about living by the sea. I want to introduce you to Jo Garrett. Dr. Garrett is a postdoctoral research associate in coastal environments and human well-being at the University of Exeter. And she led the study that we've been talking about this morning. Jo, I'm so glad we've got you on. Good morning. Thank you very much for giving us something so magical to talk about this morning.
Good morning. Thank you for having me.
Tell us what you wanted to explore in this piece of research.
So my colleagues here at the European Centre for Environment and Human Health at the University of Exeter had previously found that people tend to be healthier living closer to the coast, and this was stronger for those living in the most deprived areas. And we know how important mental health is. 1 in 6 people are suffering from a mental health disorder at any one time in this country. So we therefore wanted to explore this research and see if the coast had the same relationship with mental health.
Anecdotally, we're hearing yes, yes, yes on the programme this morning, but we can only do it anecdotally. You've done it with robust evidence. You've documented it. You've looked at, that all the information's in there about how you did the study, the sample group, about self-reporting and so on. Break down, in the simplest terms, what do you think you can demonstrate about living close to the sea and the impact it has on our mental health and well-being?
So as you say, we had a large, robust sample. We had 26,000 people living in towns and cities in England, and we compared the mental health scores of people living at different distances from the coast. And we found that those with the least disposable income had better mental health within 5 kilometres from the coast compared to those on the same incomes living inland. Whilst for those with higher incomes, mental health was not related to how close they lived to the coast.
Okay, so the closest link is for people on lower incomes. The proximity to the sea has the biggest, is most significant in that group. Is that fair to say?
Absolutely, yeah.
What is the application of this research? What could environmental organisations and local authorities and individuals do with this information?
Well, as you say, there's been previous anecdotal evidence that the coast is good for our health, but and now we're building up the evidence base that says actually, yes, we can. This has population level effects, and for me, it really highlights how important having access to nature close by to your home is. So for me, local authorities and governments and planners, hopefully they can encourage having access to nature near to where people live, and I know we've got the coast path, the southwest coast path down here in the southwest, and for me that's just such a wonderful facility, so easy to access the coast. And I hear in Kent yours is nearly complete.
They've really cracked on with it recently. Would you come and try ours out? Oh, you obviously love the coast path down your part of the south coast. Would you come and try ours out at some point?
Yeah, I would love to. Yeah. It's quite far from Cornwall, though.
It is quite far from Cornwall. You're not kidding. Is this a part of, putting aside the research and your work for a moment, is this something that's a part of your personal life as well, the coast? And it sounds like it is, that this matters to you. What does it do for you being near the sea?
Yeah, absolutely. I live in Cornwall, and as I said, we have the coast path, and I try and get out for a walk at the weekend whenever I can. And even if you're feeling stressed or you're not sure if you want to get outside, once I'm actually out there, once I'm actually on the coast, you feel yourself feeling calmer and de-stressing, for me personally anyway.
Yeah. So you're Truro, which I know quite well because I used to study in Falmouth.
Oh, really?
Yeah, where do you head? Where's the nearest, best bit of beach or coastal walk for you from where you live?
Oh, that's a really tricky one. The north coast of Cornwall is pretty stunning. Lots of hilly walks, and where I actually live in Falmouth.
Lucky you.
And Falmouth is a gorgeous place with the coast as well as rivers and beautiful scenery.
Yeah, it was interesting what John was just saying to us. He's lived and worked on the sea all his life, and if he has to go inland, he sort of finds himself a river.
Yeah.
Or do you think that sometimes those other blue spaces, lakes and rivers, can have the same impact, or do you think it has to be the sea?
I think we're actually looking at this right now. I'm working on a project called Blue Health, which is a pan-European research project, and we are looking at exactly this, basically. We're looking at different types of blue spaces, and we're looking at the different effects that people report when they visit each one. And especially in other countries where they might not have such great access to the sea, lakes and rivers might become even more important. And yeah, it will be really interesting to find out if these are having the same effect.
So that's the next level of this research, is to look at other blue spaces as well. Yeah. Excellent. Well, we look forward to finding out whether the rivers and lakes can do it for us in the same way as the sea. It's great to talk to you. Thank you so much, Jo. Really nice to have you on the programme.
Thank you very much.
Dr. Jo Garrett, postdoctoral research assistant associate in coastal environments and human well-being at the University of Exeter. And we're talking about that this morning, the coast and our well-being. And I'd love to keep going because